Good morning. This is the House Appropriations Committee. It is Wednesday, January 28th, not June, 2026, just after 10:30, and we have a whole lot of the Agency of Human Services Committee with us, which is very exciting. Welcome to all of you. We're glad to have you here. And I think this is our overview, and then we'll be taking on the department budgets as we go along. But we're starting with the top of the heap and the big picture for your agency. So welcome, introduce yourselves and take it away. Thank you.
Morning, Chair and committee members. For the record, I'm Jenny Samuelson. I'm the Secretary for the Agency of Human Services here in Vermont. And I'm joined by our executive leadership team, which includes myself, our Deputy Secretary, our Medicaid and Health Systems Director, who is absent today, and our 6 commissioners, and our Chief Financial Officer. And I'll let you introduce.
Yeah, thank you. For the record, Tracy O'Connell, Chief Financial Officer for the Agency of Human Services.
Okay. And Chair, how would you prefer we take questions ongoing or go through and take questions at the end?
If you have sort of sections, so I can just see if there are questions at the end of each section and try to do it that way. Okay, sound all right?
So the Agency of Human Services, as I don't need to remind this committee, includes 6 departments: the Department for Vermont Health Access, the Department for Health, Department for Mental Health, Department for Children and Families, the Department for Disabilities, Aging and Independent Living, and the Department for Corrections. It also has the Secretary's Office, and within the Secretary's Office, we'll go into more detail, but some key programs there include the Blueprint for Health, the Office of Healthcare Reform, the Vermont Chronic Care Initiative, the refugee programs, and the Field Services Division at the agency. Our overall budget is $3.75 billion, and it is spread out across those departments. The Agency of Human Services is one of the largest agencies in state government, with a little over 4,000 positions. On this slide, you can see the positions as they are described in the agency. Also on this slide is the current vacancy level for those positions across departments. So as we look at the budget this year, again, we're looking at a budget of over $3 billion. We are looking at an increase of $86.1 million, or a total of 6.1%. That increase includes $74 million, almost $75 million in direct current services or base funding to keep the current programs that we have at the agency going. It also includes $11.2 million, or 0.8% of general fund to increase the direct the space for initiatives and new things for this year. The reason we brought our executive leadership team with us today, and the names of those members are here on this slide, is because this budget process this year we did significantly different than the way that the agency has done its budget process for as long as I've been with the agency. Many people know, if you've been around, the agency has often talked about being one agency. In our work this year to look at and evaluate our agency structure, one of the things that consistently comes up is that it's really valuable for the components of the agency to be together, but we need to do the work to make sure that they're better aligned. And so what you will see as the budget process this year is intended to do exactly that.
Did you find that helpful to do it a little differently this time?
We did in the past, and I've been with the agency for 20 years, and in leadership for many of them. The way that the budget process has worked is that we get a target from the executive branch, from the administration. We then take and hand that target down to each one of the departments. The departments in their own departments looks at their budget, decides how to meet that target, and then they propose it back up to the secretary's office. And then the secretary is the one, the secretary of the secretary's office is the one who makes the decisions about the way that the budget works. If we really want to lead across the agency, then we need to empower our executive leadership team, including those commissioners, to wear 2 hats. not just the hat of their department, but also what it looks like across the agency. And so we tried to put our money literally where our mouth is in this budget process. So the way that we did it is the first thing that we did was look at what are our priorities. We looked at the governor's priorities. Everyone's heard them for years. They've been consistent: grow the economy, make Vermont more affordable, and protect the most vulnerable. There's a major component of the Agency of Human Services in those priorities. And so we asked ourselves, what are the things that we need to focus on as an agency over the next year, 3 years, 5 years? And that executive leadership team identified 4 things for us to really focus on. We need to keep the rest of our programs running, but the 4 things to prioritize were really housing, with a particular focus on addressing homelessness in partnership with the other agencies in state government, substance use and mental health, and that's across prevention, treatment, recovery, and stability. And in this case, what we're really talking about is how do we really integrate these systems? Because the majority of the people who receive services in the mental health and substance use system receive them in both systems. It's how we do healthcare affordability, sustainability, and quality as a major priority for the agency. And then looking back, one of the most valuable resources that we have as an agency that we don't talk about enough are the workforce that we have, the people who do the work on the ground every single day. So how do we make sure that we're building a strong and resilient workforce within the Agency of Human Services and also within the human services agencies outside of the agency? So this year we took and looked at we did an evaluation of the programs across the agency. We looked at what data do we have, particularly starting with the Medicaid program. So as folks will remember, the Medicaid program isn't just DEVA, but is actually run by, there are elements of it in every single department across the agency, particularly in Department for Mental Health, Disabilities, Aging, and Independent Living, DEVA, and the Department of Health. And so we evaluated those programs on multiple different areas. And we evaluated our budget to make sure that it aligned with the priority areas. So what could we do to make sure that we were investing in things that really made a difference for Vermonters? And did our investments reflect what our priorities are going forward? We took, and I'm representing this work for the entire executive leadership team who's here. We'll happily, the whole team will take questions. But we took an inventory we started by taking an inventory of our current services cost. How much is it going to cost to implement the programs that we currently have implemented through the Agency of Human Services? That initial look showed a pressure of over $117 million just to keep the base programs that we currently had going.
As is, not changing any program.
Not changing anything. Then we compared that against the 3% target, which we anticipated that we would receive, and which many folks saw in the budget instructions. That 3% target gave us an increase of $42 million, which left us short by about almost $75 million. So that's where the agency started in our budget process. We asked the departments to come forward with areas for potential savings to the executive leadership team, not to the secretary, but to the full team. And we did that by focusing on identifying things like revenue offsets, looking at administrative and program efficiencies. And this was a key area that I don't think the agency has done for many years, which is to look at whether the programs are achieving the outcomes. Are they equitably distributed across the state? We have many pilot programs that either started as a pilot or started in one area and have shrunk down so that they're not accessible to all Vermonters. We looked at how many Vermonters they served, and which of those programs were required by the federal government in the programs that we administer. We looked for program reductions based on some of those efficiencies and effectiveness. I also want to say that we looked at how we administer our programs and where we could get cost savings within the agency. So we weren't just looking for program efficiencies. We were looking for administrative efficiencies where technology or where programs had changed and where we could gain those efficiencies inside of state government. And so based on those program decisions, we made sure that we aligned, again, from the previous slide, what was the most effective programs that we had and what were our priorities in order to achieve the overall goal. Anything you want to add? Okay, that's great.
Okay, so we'll delve into what we were seeing for current service pressures, which the Secretary alluded to, which when we whittled it down, it was about $115 million in increases for current services. Two of the biggest areas being revenue loss, backfill of lost revenue from federal grants or from special funds, which I'll get into more detail. And then also in the caseload and utilization space, which is what you also just witnessed in budget adjustments. Yeah. So for the backfill of lost revenue, the biggest change we see is $13 million needed to backfill the FMAP change. FMAP is the federal medical assistance percentage that CMS matches Medicaid with. Right now, for this budget, it is 58.07%. And that is a 0.73% reduction from the previous fiscal year. So that means that we will receive $13 million less from the federal government, and we have to backfill that with general fund, just all things being equal, current services, and building the budget.
And then this one, I want to note that this is a usual process. The FMAP is reconsidered every year. We often get the question, is this related to anything different happening at the federal government? This one is not. Our FMAP rate is actually historically high for what it has been and continues to be high. And so this is a normal annual adjustment. Some years it goes up a little, some years it goes down a little. But because of the magnitude of the Medicaid program, it has significant impacts in the overall budget.
Is this the one that they tie it to household median income or something?
Yes.
Yes. I remembered something.
Nationwide.
Yeah, well, that's what I mean.
It's not.
It's what it is. Yeah, I get that. That's what I mean.
They haven't changed the calculation at the federal level.
The next area is for SNAP admin with HR 1 beginning in October of 26. The federal matching percentage will be reduced from 50% to 25%. Therefore, the state has to kick in 75%. And so for on a 3-quarter year basis, that equates to $4.5 million in lost federal revenue that we need general fund to backfill. And then the next biggest area is the child care special fund revenue downgrade from the economist forecast. That's part of the, yes. I think this program is still in its infancy and they're still trying to understand what the projections will be in the area of the 0.44% payroll tax. And so we're seeing the economist forecasted an $8.7 million decrease.
Would that only have an effect on your budget if there were enough people applying for vouchers?
That would be separate.
Okay.
This is just the payroll tax collection. We're just not seeing the receipts that were anticipated.
But it's used for.
And we are not adjusting the program. The caseload, correct. The caseload and utilization for the CCFAP program is remaining steady. And so we need the same amount of spending authority to maintain that program. We just are missing some special fund to help support that.
So is this a reduction in the payroll tax, meaning that fewer people are participating, or it's growing slower than was expected? Or is it's expected to grow more slowly than was originally forecast?
I think that is the question for the tax department. The tax department is collecting the 0.44%. And I think it's only been a year. And so I think they're looking at what they are receiving, the cadence by which they're receiving the collections, looking into compliance of, who's paying. So it's still pretty early, but this is what we're anticipating for receipts.
Have to go with the revenue.
Yeah.
Did you have anything else on that? That covers it. Okay. We'll know more as we go along. Mike, you have a question on this? Yeah.
Are we going to wait for questions?
Well, let's just
Yeah.
quickly ask this one and we'll go on.
Well, just to put it in the parking lot, if you want, going back to vacancies. It's a 30% vacancy rate. for mental health, and an overall vacancy rate of 11.5%. How does that compare to past year?
Yeah, that's a great question. So the vacancy rate, and, Commissioner Haas can add in here. But the vacancy rate at the Vermont Psychiatric Hospital is the vacancy rate that is driving that 30% in the Department of Mental Health. Post the pandemic, like many other healthcare facilities, Vermont Psychiatric Hospital saw significant use of traveling workforce. That was, we had a vacancy rate of coming out of the pandemic, like close to or at 60%. So what you're seeing here is slowly we're beginning to fill those positions. And we've gone from a 60% vacancy rate down to about a 35% vacancy rate today. And so it's important to put a pin in that, because we will be actually talking about one of the budget reductions later on applying the VPCH. So again, we've seen high vacancy rates coming out of the pandemic, and that's been reduced over time.
So right to this page.
Moving on to caseload and utilization. These are a few of the same items that we saw in budget adjustment. The Medicaid consensus is $14.9 million general fund, or $35 million gross, clawback and buy-in. And then we have adjustments for the developmental services caseload, which is $4.1 million general fund, or $10 million gross. And then nursing home bed days and home and community-based services utilization, $4.4 million general fund, for $10.6 million gross.
I'm going to pause here. Any questions on these pressures?
Makes sense. Maybe not happy, but it makes sense. Yep, thank you.
Salary and fringe benefits for the agency equates to about $21.3 million general fund. And this includes a request for just shy of $500,000 general fund for 12 new HAYU staff that will be needed to support the Medicaid work requirements and the biannual redeterminations that go into effect at the beginning of calendar year 27.
So we'll dive into that more with the appropriate department.
With DIVA, correct.
Yeah.
Mhm. And then for operating, we have an increase of $6.5 million general fund, the bulk of that, which are the internal service funds, which I know you're familiar with, HR, insurance, ADS, so those bill backs. And then we have a increase in the DIVA Program Park piece, which you saw also in budget adjustment. This is for the full year. And then some operating expenditures for DOC related to vehicles, utilities, uniforms, and inflationary pressures.
I'd like to clarify one thing, the 192,000 for Clover Park. Seems like that was in the BAA.
That is correct.
But that's for a whole year, or is that just for the half a year?
In budget adjustment, it was for half a year, and so this was for the full year.
This is for
This is
the,
on top of what we had last year. This is like the increase.
This would reflect because this is a new lease, this 192,000 would be to pay for July 1st of 26 through June 30th of 27. Moving on to contracts, $17 million general fund pressure, and most of this is what we saw in budget adjustment. There's a few at DIVA related to Gainwell, the call center, and the Medicaid data warehouse. Transportation at DMH and DCF, DMH forensic evaluations and travel nurses, the Wyndham Youth Crisis Stabilization Program, WellPath to adjust the average daily population increase. And a new item that wasn't in budget adjustment is $247,000 to address transitional housing. With the Burlington Housing Authority, they received a reduction in some of their federal HUD funding. And so this seeks to maintain that level that they were receiving.
So there
They can maintain the same number of beds.
Okay, so there is, what's the name of the place in Burlington? It's the transitional housing. Do you remember?
Commissioner Murad?
Burlington Housing Authority.
No, I know the housing authority, but the traditional housing, is it a specific house, or is it just in a certain apartment building? Or?
I think it's just, it's units within the facilities they.
Okay. Okay. Thank you.
Okay. $10.6 million general fund is going to support multi-year programs. These are programs that we started in state fiscal year 26, but because they were only built into the budget for half a year or a quarter year, we needed to annualize them. So for example, with DIVA, the Medicare Savings Plan, that turned on in January of this year. And so only 6 months was built into the budget. And so this annualizes that amount.
That's what we approved. It was the benefits cliff kind of thing when people were turning 65 and
Correct.
trying to smooth it out a little bit.
Correct.
So this is the first year it's actually happened.
Yes, it went live this month.
Yeah.
Yes, it went live this fiscal year, and then this is annualizing it for the.
Right.
Correct.
Okay.
And DMH, alternative to emergency departments. This is backfilling the Home and Community-Based Services FMAP spending plan that is just about fully exhausted. And so this is annualizing a couple of the programs that were very successful under that effort in DMH. And Commissioner Haas will speak to that later today. And then for shelter investments, 7.5 million. 1.3 million of that is for cold weather shelters and 6.2 is for hot shelter expansion. And these were previously funded by one-time dollars that we are seeking to build into the base.
Okay. So how much was it in FY 26? And maybe that's a question you can't answer.
In the
I'm
base,
thinking we had a 2 million here and a 4 million there for shelters, and I just don't remember what the.
I think that we can definitely, if Sandy has it.
We'll have DCF talk.
DCF. What I think you'll see this year as you come in is is a shift and a change in moving some of the things that were one time that we know are going to be important for ongoing operations. And this is one of those areas where you see that, where those shelter investments really make it from one time to the base budget, but continue the overall investment in housing.
Shelter investments, what does that involve? Purchasing property, improving property?
It involves again, it's the cold weather shelters. This year, and Deputy Secretary can answer this question as well. But this year we put in place statewide extreme cold weather shelters. That is a portion of it. It's $1.3 million. The second, and we will go ahead and put that into the base. The second piece of this are shelters that actually are new shelters that came on.
Buy them, we lease them?
We'll get into the details about that when we're trying to keep this sort of the overview.
Right.
So I'm taking notes on what I want to talk to who about when they come up, so. And now you have fair warning of some of the questions we're going to be asking, so. Okay, continue.
so we have a few areas to address provider rates. Most, with the exception of the Northeastern Family Institute, the rest of them are either federally required or state rule required to address inflation. With Northeastern Family Institute, this is a provider that's kind of been an outlier in years past. They haven't received those across those 8%, 5%, 3%, 2% rate increases that some of the other home and community-based providers have received. And excuse me, we're seeing a need for this provider to address stability to build into the rates.
Okay, so in this case, this is an.
Water over there.
Thank you.
Okay. What you see here is I'll just catch up to where we are. What you see here is an increase in the general fund for current services. What we have is an increase in general fund revenue of 30%. We see a savings in our program and caseload utilization of 13%, a small and slight rate increase, programmatic efficiencies that we were able to gain from our departments, and administrative efficiencies, and then program and service reductions. So this is where we were able to address that gap that you saw between where we started and where we ended up in our budget.
But just so I understand this correctly, the program and service elimination, so that's really, you save 24%, you cut it 24%.
Yeah.
Or something, right?
Yeah, so exactly.
Okay,
So in this case, what we saw, I'll go back through it more slowly.
okay, and then, but you also have increased revenue?
We do have increased revenue. So why don't we go
We'll
through?
go through all of
So
it.
let me go through,
It stands out when you see increased revenue.
let me go through where those are.
Okay,
Okay, so we're going to start with the revenue. What we saw is that in the Secretary's Office in the Global Commitment Budget for new adults, that new adult group has a higher SNAP rate that, at 90%. And so with an increase in utilization by new adults, we saw an increase of $3 million in our budget for our Medicaid program. The Secretary's Office also receives a 70% match on our FMAP for our CCBHCs, or funding going to our designated agencies who have moved into the CCBHC model. That increased match rate gives us a savings of $6.6 million in our Medicaid program. In our substance use treatment, we have federal grants in our block grants of $1.5 million of increased revenue to help offset some of the costs in our substance use treatment programs. For the Department for Mental Health, we have an opportunity to increase billing to Medicaid for the services that are offered there. And based on our ability to draw down federal match for those Medicaid services, there's an anticipated increase in revenue of about $500,000. And then folks will remember that in HR 1, that there was a requirement to have cost sharing, particularly in prescription drugs. In this case, we are increasing the copays based on the requirements in HR 1. The question we often get is, what does that mean what does that actually mean in a dollar amount? It depends on the medication and the prescription, but it's a $1, $2, or $3 copay. Diva can go into more detail about that, about those copays. So, Sarah, I think that covers the revenue. Any questions there?
so, yeah. So we're saving money and somehow that becomes revenue. Or
We actually, in this case, we are drawing down more federal funds
Oh, okay. Got
in these cases, minus the last one, where the revenue actually comes from prescription.
right, okay, so savings, okay. Great, is it nice to know these days we can draw down more federal funds?
Yep. Good?
Yeah, I'm good. My apologies. We have a few
Tracy
areas.
was out yesterday, so we appreciate that she was in
Yeah, I
today.
just had a little tickle.
Help me drag up more cough drops. I just let
This is good.
everything, okay?
A little tickle. Caseload and utilization, $5.1 million general fund savings. There's an area of underutilization for the level 1 beds at Rutland Regional that DMH pays for, about $718,000 general fund. And then some savings in DCF reach up and substitute care for those caseloads. And then also adult day health and rehab services, $419,000 general fund.
So we can ask Dale about why that's decreasing when Dale comes.
Yes, you can't. In most of these cases, these are a true up to actuals. And so when we think about the adult day and rehab as an example, what we have seen is a lower utilization, even with the department, even with Dale working directly with those adult day centers to take specific actions to try to make sure the services are provided. We just post-pandemic have seen a reduction in the number of people who are actually seeking those services.
For our administrative efficiencies, we've identified $7.3 million general fund. Each department looked at their prior year spending in terms of operating, so travel, equipment, supplies, fleet, and contracts. And so we right-sized budgets there to the tune of about $811,000 general fund. And then DMH and DOC adjusted the vacancy savings more in line with what you saw in the first couple slides to adjust those vacancy rates, $6.1 million. And then Dale did a technical adjustment in other personal services for that budget line item.
Back to vacancy savings for a moment, just sort of philosophically, are you intending to keep those spots open, or are you trying to fill them and just thinking that the timing is going to create the savings?
We continue to try to fill the positions across the agency. But at this point, I think we are recognizing that, particularly for corrections, we've hit kind of a steady state, even though we continue to take significant efforts to increase recruitment and retention. We would, if for some reason that we do adjust back up and increase the number of employees that we have, we would adjust the vacancy savings appropriately. What you will see, and in a subsequent slide, is that at the psychiatric hospital, based on caseload and utilization that we have across the state in the whole mental health system, and based on what's feasible and economically appropriate, we are looking to move from 25 beds to 21 beds. And that, in that case, we would not be permanently seeking to those.
And John, you had a question.
Sure, just real quick, and if it's coming along later, I can wait here, but the drawdown of more federal funds, is that across what you just talked about here in terms of caseload utilization there, or is it in other areas?
The increase in federal funds that we've seen are in these areas where we're able to draw down more federal funds in these specific areas.
Yeah, so in the childless new adult space, yes, that's an increase. The utilization is more than we had budgeted in the previous year. So, yeah.
Great, thank you.
So you see both decreased revenues in some areas and increased revenues in other areas.
Yeah.
Yep.
Thank you.
Program efficiency, so $6 million. One area to highlight, I'm not sure if you've been made aware, but we're seeking to move the school-based services program that is administered at AOE or to DEVA to address Medicaid compliance and to just build some efficiencies. Currently, again, it's at AOE, and BDH has a portion for school Medicaid administrative claiming. And so by putting it in DEVA, we think we can achieve about $450,000 general fund savings there. DEVA is going to implement utilization management for durable medical equipment. That should save about a $922,000 general fund. And then we also have the applied behavioral analysis coding compliance savings that we brought to you in budget adjustment. That goes into effect this month. And then, as the secretary just alluded to, we're suggesting that the VPCH beds be reduced to 21 beds from 25 beds based on historic utilization of that unit being closed. There's also $1.9 million worth of general fund at Dale for the ARIS payroll benefit percentage withholding. This is excess cash on hand at ARIS, so there's no impact to consumers or providers by
ARIS.
ARIS is the
Payroll.
Payroll,
They're the payroll.
primarily payroll, but it's the benefit cost that was part of their. It's underutilized, so we can pull it back for the employees.
So are there benefits that employees are now not going to get?
No.
No.
Will be
So-
impacted by this.
Yeah. This is
No
just.
provider, no individual.
This is funding that had accumulated at ARIS, which administers the payroll for many of our home and community-based service providers. And over time, they've built up a cash balance. And so what we're saying is, rather than sitting on that cash balance, we're going to draw it back. We're going to drop back and use it as savings for this year's budget as a one-time. So it doesn't impact clients, and it doesn't impact individuals who are getting paid.
For providers.
Great, thank you.
So the agency has identified about $9.9 million worth of program and service reductions or eliminations. This is just a small subset of the list. We have about 38 programs that we're either proposing to reduce or eliminate. In the materials, the supplemental materials, we have a whole one pager that kind of summarizes more of these in detail. And so you can refer to that after our testimony. But here's just a snippet of things that we thought we should highlight. For the Secretary's office, there's a $500,000 reduction for the Refugee Transitional Housing Program. A couple years ago, $900,000 general fund was built into the base to address refugee transitional housing. However, due to the change at the federal level, we are receiving about 75% less refugees in Vermont. So where we used to receive between 400 and 600 a year, it's now hovering at 100. So there's not as much of a need for transitional housing. There is still a need for wraparound services, legal services, case management services, employment services. So we are seeking to keep it 400,000 in the base to address that, which is complemented by the federal funds that we do receive for some of those programs. But unfortunately, we're seeing a reduction here due to less refugees. DEVA is proposing to eliminate the Vermont Legal Aid Medicare Assistance Contract. This is actually codified in statute that if the contract is not producing revenue savings to the equal amount of the value of the contract, that it could be proposed for elimination. And so that is what DEVA is seeking to do here.
I'm sure they were really about that as well.
There's $2.1 million savings for the ACO, the Accountable Care Organization, per member per month payment. As most folks know, that program ended last month, the Accountable Care Organization. And so that funding is no longer needed to support that program. EH has a couple of reductions in the area health education centers and the education loan repayment program that I know that Dr. Hildebrandt will speak to in his testimony, but just to highlight that we see the RHTP grant award as an opportunity to redesign that program and leverage that federal fund.
For the education loan repayment. So you're talking about the rural health transformation, the 195 million a year thing.
Yes, the Rural Health Transformation Program, I just wanted to clarify, we're looking at reinforcing the workforce options. So things like paying for tuition while people are currently enrolled. There were some prohibitions. We could not pay for actual loan repayment using those funds, but there are significant funds invested in the rural health transformation that actually support what we've seen as evidence-based programs to increase workforce in Vermont.
So, but the loan repayment program is going to go away.
There continues to be loan repayment and other programs through VSAC, but yes, the one through the area health education centers, there's funding.
Oh, this is the AHEC.
Yeah. So again, we have multiple places where we're doing loan repayment right now. The majority of it is out of VSAC. This consolidates that.
Okay. Yeah, Dave.
You said it consolidates it. Are there actual savings? Or are they being transferred?
It reduces the amount.
So it is a reduction. I'll ask at the department level, just be curious what the total number is and what percent this might be is a reduction to that. Thank you.
Yes, thank you. I would recommend as you go through that with the Department of Health,
Yes.
that you also look at what the overall package is for our workforce, particularly the workforce training programs. A significant portion of the rural health transformation funds are invested in that, including a program where we would have a rural health residency program for physicians in our federally qualified health centers. So there's a pretty robust package of workforce development programs, again, those that are promising in the space.
In DMH, there's a proposal to eliminate the Chittenden County Community Outreach Program, 160,000 general fund, and outpatient services for traumatic brain injury, elder care and reach-up services, and the care coordination that was actually only available at one family practice. And again, Commissioner Haas will be in later today to speak about these programs. DCF is proposing to reduce the amount of hours for the 211 call center since some of those calls cannot place individuals for housing after 11 o'clock since the hotels will not accept placements. And so we're seeking to build efficiencies there by reducing the hours of operations for that call center. The Strengthening Families Program and reduction of just shy of $500,000 general fund, and some eliminations for reach-up agreements and one position in the Reach First program.
The one thing that I think is important to note with all of it was a very difficult decisions about what programs. The agency did something that we have not done in a long time. And we looked at the effectiveness and efficiency of each one of the programs, statewide reach, whether they're federally or non-federally required. As we go through the programs, I think it's important to ask, what were some of the reasons behind eliminating some of the programs? We cannot, at the Agency of Human Services, some of these were programs where there was duplication of efforts, for example, in some of the crisis services in mental health, where we brought on new programs that are more effective, like 988, mobile crisis, and the alternatives emergency departments. It's incumbent on us as an agency to actually then go back and look through our portfolio to make sure that what we do is effective and efficient. And so I know for many people, these programs are programs that they designed, they developed, and they built. Some of them are programs I've designed, developed, and built, including the ones at ACAC. And so, but I think it's important for us to ask ourselves, is this the best use of that's the question that as an agency team, with the executive leadership team, we ask ourselves, is this the best and most efficient use of the funds that we have available? Because we don't have unlimited funding.
That's right. That's right. And this is what we asked you to do. And so if you came to us with absolutely no changes, that would not be a big thing either. So it's great that you're, doing this exercise. And I know it's not always easy to make these decisions, but we need to do some things differently sometimes.
And the programs had clear criteria, and they can share that with you, particularly for the Medicaid programs, to make these decisions.
Stop me if this is something that we'll talk about later, but on the 211 hour reduction. So what happens if I call at midnight? You said that if I'm not calling for housing.
The calls that we're receiving in the night are typically around the housing program. And right now, if you call to get placed for an emergency voucher, which is why DCF is the one who is funding it versus another part of the agency. If you call in the middle of the night at midnight and you ask to get into a hotel room, they'll tell you to call back in the morning. And so for those folks who are asked to call, who are calling in the middle of the night, there's really no opportunity to serve them. And so this was a difficult decision. It was based on call volume. DCF can go into it in a lot more detail. But what we found is that there were very infrequent calls that were anything other than our housing program.
So if I needed housing and the hotels or again, calling back in the morning, I'm just curious. I mean, we've been back and forth over the last 15 years about how 211 is funded.
Yeah.
So no, we'll ask more questions later.
I think it's a really valuable question. And that's why they took at their call volumes and what types of calls that they were getting. And again, if someone calls at midnight, hotels won't intake someone at midnight. And they're just telling them to call back in the morning. And to call ESD and economic services.
Thank you. That's enough for now.
Again, I think I have copies. It should look like your committee assistant handed them out.
Yes.
This is the full list so that you have it in one consolidated place. If yours is tiny, I'm also welcome to hand out the little bit bigger copies. But this is a consolidated list that reflects the work that the agency did. It lists the 39 programs and where they are, and it lines up with the presentation here today. Revenue pressures, salary pressures.
Perfect. Thank you.
So we know that one of the things that we also said, and it's hard to have the conversation about the efficiency and effectiveness of programs and making decisions to cut them at the same time that we look at aligning resources and gaps in the system. But the agency did look at where it made sense to align our resources with our priorities. And you saw investments of that overall. What you see investments are in emergency housing, a $10.1 million general fund investment in family-specific housing units, domestic violence-specific units, those for medically vulnerable. These are all sheltering options so that we make sure that we enhance the shelters for our most vulnerable Vermonters. We also know that we need more recovery housing and recovery shelters, places that individuals who are currently in recovery have access to continue to maintain and support their recovery. There's case management enhancements. rental assistance, and overall staffing support. These are built in primarily to the DCF budget, but we knew that housing continues to be one of the things that we need to address as an agency. There's also, that's base budget. There's also one time of $21.1 million for the regular general assistance housing program, the weather dependent program, and additional staffing. Dale, over the last few years, has implemented a program in collaboration with the Department for Health. This program specifically was funded by the Opioid Settlement Fund. It has proven to be very effective. What it does is for individuals who are currently experiencing substance use disorder, it provides job training and support to help them move forward in their recovery. Again, this has been very successful. It is not, as far as we know, the letter being funded by OSAC this year, and so we want to maintain it. It does present both the benefit and risks of the OSAC funding. In this case, this is a program that was an initial pilot, and how we move pilots to programs both statewide and out of one-time funding sources so that they can get the stability is a question that we really should be asking around what we fund with our OSAC funding. In addition to that, pretrial supervision is moving to statewide at a cost of $200,000.
That's been very successful.
So the central office of the secretary's office, and we'll walk through in more detail the ups and downs in this budget. But the secretary's office, as many of you are already aware, includes the general secretary's office and our staff. It includes healthcare reform, which has been responsible for planning, implementing, and coordinating healthcare reform initiatives. For example, they are the ones who applied for and received the rural health transformation funding. They're the ones who applied for AHEAD. They're the ones working with primary care and working with the hospitals to reevaluate what those systems look like and what investments are needed. Field Services is charged with optimizing the functions of the agency on the ground in each one of the districts across the state. Our refugee programs support refugee resettlement in the state and provide funding and support for those programs. We have Serve Vermont, and then we have two committees and commissions.
So the entire central office budget, or the secretary's office, is 30.1 million budget, 30.1 million, all funds, and you can see the fund breakdown below. And we have 78 positions, 3 of which are vacant. Prior year accomplishments that central office team partook in, and so we just wanted to highlight some of those.
So field search, just these are give some examples of some of the units. Field Services and the Vermont Chronic Care Initiative work very closely together. They're in the same unit. They include in the last year, they were instrumental in getting the family shelters up in both Waterbury and Burlington, and particularly in getting and coordinating the services in those family shelters. They've also were instrumental in Burlington, getting at and coordinating the services in the Burlington Accountability Court, which has been an instrumental component of connecting people with services currently in our judicial system.
So with regard to the family shelters, these two particular ones, if we want to get more detail about costs and numbers of people served, et cetera, is that your office or is it one of your other departments?
In this case, the Department for Children and Families can help provide and illuminate that cost. Where Family Services came in, it was really working with the community to figure out where to site that, working with the community to coordinate the service providers. And so I think the theme that you're going to see across a lot of the initiatives that we did and across these is that we really are working across agency boundaries. And so it's difficult to attribute success to just one department when the agency is working together across.
It's nice not to have silos. I just want to know at the moment where I can get the data about the shelters. Would that be from DCF?
Yeah, I would request it from DCF.
Okay, great.
But that's where you're going to get robust.
Thank you.
We also have been working in healthcare reform on hospital transformation plans and the rural health transformation program where we got and sought funding. And if we are successful in the 5 years, could equal almost $1 billion over 5 years. And then this year, we really were able to support when we saw all those ups and downs in what the federal guidance was going to be for the SNAP program. One of the folks that were carved out of that, or group of individuals carved out of that, were individuals who were refugees and asylum seekers. And so through the refugee program, we were able to make sure that there was at least some support in communities for families who were transitioning off of that program.
Here's the slide shows a snippet of the traditional ups and downs by line item, which I know we don't have to go into detail on a lot of them, but just shows the various changes. And so then the next slide, just a little bit more description on some of those changes. About $2.8 million reduction in general fund for the ADS service level agreement. Those costs have been shifted over to the ADS core enterprise service allocation as part of the internal service fund, which I'm sure you're seeing across.
Probably see that. This is a new thing this year?
Yes, where they are reduced. So they've reduced some services in the service level agreement, such as Microsoft licenses, desktop support, a couple other things tied to licenses, and said, hey, this is part of core enterprise services. And so, here's an annual allocation instead of just looking at, the number of individuals. So each year.
We'll be talking to ADS, I'm sure.
Yes.
Yeah, this just spins me around on our
Yeah, I know.
the saga of ADS service level agreement. So last I heard previously on ADS, we heard that maybe AHS or some other, would get a chunk of money and then it was allocated, the costs were then divided in between all the different divisions.
Yes.
This is implying that maybe what you're getting charged will be less because some of this will be moved over to a different silo, but you'll still be given an invoice that you then have to split up.
Yes and no. So you are correct that in budget adjustment, we had funding for the service level agreement in the secretary's office budget, and then we parsed it out to departments once we had a better handle on which division or which department should get their slice of the allocation. In 27, what ADS has said, okay, now your whole service level agreement is being decreased, and however, some of it is now going into the ADS allocation. And so they've determined that amount they've already predetermined that amount, what should be billed by department. And so you'll see increases to the ADS account code, the ADS allocated charge. You will see increases based on those allocations that we receive via finance and management. ADS work with finance and management to assign these allocations.
So never mind the built-in obsolescence of any kind of software and whatnot. How many man hours do you have to budget for in order to manage just that line?
I have to get back to you on that.
Yeah, we'll have to get back to you.
It's an interesting question. I'm not sure we've thought about it in that way.
Well, it may be somebody that you wouldn't hire, or maybe it's something that you just spent 5 minutes and you can probably do that in 10 committees. So there's an hour of just trying to explain it.
No, there are a lot of components to it. It is true. And so this is where I think they are trying to align it with core enterprise services. And by no means am I an expert in that area. And so that would be an ADS question as to what are we getting for in that space? But
Again, core enterprise services is something that everybody has to have.
Think about your laptop and the other types of things that we need to do now in a modern business world that every single one of our employees needs. And I think that what they're trying to do is acknowledge that modernization and capture it in a different financial way to try to make it more efficient and more effective. So there's not as many man hours spent on accounting for it.
And I know that those are the words that we try to put to modernization, but it still seems to cost. We didn't seem to charge off like index cards when we were doing all this by hand. I understand what the conversation.
I think we're gonna hear about that on Thursday.
Oh,
Yes.
Index cards?
Yeah, no, the move away from index cards.
Okay, in the secretary's office, we also reduced general operating expenditures by about $158,000. We took a look at what prior year actuals were for travel, equipment, fleet, and other. And so we were just right sizing the budget there. The refugee transitional housing, I already spoke about. We're seeing 75% less refugees. And then two other small reductions. One is for the field service coordination grant. There was only 2 districts that had grants for this extra support for the complex cases in those districts. And the field service directors believe that they can take on that work now in-house. So we don't need to exercise those grants any longer. And then a $19,000 reduction for a foster grandparent program that ended at United Way. This particular portion of money was used as state match on one of their federal grants that they no longer applied for. So that program is no longer in play. And as the secretary said, we offer support to 2 other areas in central office, the Developmental Disabilities Council, which is 100% federally funded. It has 3 physicians, and also the Human Services Board, which is a blend of general and federal funds, and 5 positions.
So if we wanted to find out more about the Human Services Board, we'd ask you guys.
Yes, yes. And there is a report that they do an annual report that I can share a link with.
Oh, that would be great.
And it talks about the number of cases.
Yeah, because I think there have been, anecdotally, I'm hearing that there were a lot of appeals around eligibility for the hotel motel program. And I have this all wrong, but I think that's what I heard. There were a lot of appeals, and the people who were appealing won in many, many cases. So I'd like to get some data around what's happening with the Human Services Board, just so I can understand that.
Specifically around that related issue, I think DCF can provide you some significant insight.
Okay.
I think that, there's part of that is an interpretation of the previous legislation that they can provide.
Yes, but any data on what the board does, and
Yeah,
that would be really helpful.
This next slide just shows the line item, the ups and downs across account code and fund area for those 2 divisions. And then we'll get into global commitment. The AHS Secretary's Office Global Commitment Appropriation supports the global commitment spending that you see in all the other departments. B301, yes. Also known as the mixing bowl. It's both of the federal and state match associated with paying the global commitment fund. And again, the match percentage, the state share match is 41.93, with the federal match being 58.07. In 2026, we need to submit our 1115 Global Commitment to Health Waiver Renewal application. That's due by the end of the calendar year. And then we will embark upon a 1-year negotiation with the CMS to renew that for the end of calendar year 27.
And I imagine it's going to be a little different than the last time we negotiated. It's a different administration. So probably a lot of different people at CMS than were there before.
I think that that's an appropriate assumption. We were asked by the Human Services Committee, what do we anticipate is different?
Yeah.
Until we enter into the negotiations, I can't speak to that.
Right.
But what they have clearly said is that there are things that were authorized previously, particularly around health-related social needs, like housing, which is a benefit that we have not exercised because they have been very clear that they are going to eliminate it in the next negotiations. Vermont's waiver is also significantly different. It has allowed us to be very successful in the state at really getting to prevention and cost containment. But some of those investments that we at times think are base Medicaid are actually both investment dollars or program or operations that we've chosen to engage. those things will all be, I think, a point of discussion with the federal government. Again, because Vermont's waiver is unique to Vermont. There is not another single state that enacts their Medicaid program the way that we do. I would say it's helped us be very successful, but there will be a lot more questions on those investments as we go forward.
Yeah, that's what worries me, is what they're gonna decide at the end of the day, even if we've been very successful in the programs that have come under this grant.
I think that the insight that folks have asked for is a better understanding now of what are required programs under Medicaid programs, what programs are programs that Vermont has implemented as programs under the Medicaid program, and those programs that are investments.
Yeah.
I think some base background for folks as and before we get into the waiver will help understand what risks that there are.
Yeah.
We've done that analysis internally already. And I'm sure that we would be happy to have our Medicaid policy unit and department come in and share some of that. We don't want to precede our negotiations and disrupt. We don't want to make it harder for us to negotiate.
Absolutely.
But we can at least illuminate for you what programs are required federal programs. We looked at it actually for our budget for this year.
Yeah.
Which programs are non-required programs and which programs are investments.
That would be great. Once we get the budget out the door, we'll have you back in April.
Whenever is convenient.
Yeah.
I just think it will be helpful as a base.
I think it would be. Thank you. John?
Just answer my question. I was going to ask with all that you're presented so far, that help you once you get to the negotiation of the next year.
Yeah.
To help maybe perhaps hopefully streamline that as best you can.
Exactly. We have been preparing for these negotiations for some time. There hadn't been before, but there is now a Medicaid executive team within the agency who is trying to ensure that there's alignment across the Medicaid program, across departments. And they really, that's led by our Medicaid policy director and our Medicaid director and our CFO, Tracy. They've done phenomenal work to understand these key pieces to help us with the negotiations. Again, we'd love to share it, but it also demonstrates the work that we're doing across the agency to break down the silos, to make sure that our Medicaid program is administered consistently across the agency and not just piecemeal by department.
Thank you.
Here is a snippet from the ups and downs for B301. And just as a reminder, anytime there's a change in the global commitment for the departments, the 6 AHS departments and the Secretary's office, that flows through to this appropriation, both the state and federal share. And so just to highlight a couple other things, well, we talked about the 13 million backfill of general fund, or the 13 million backfill of federal lost dollars for the FMAP. That's in that appropriation B301, as well as a special fund for the Success Beyond 6 program that the designated agency supplied a match for.
Tell us what CCBHC is.
Sounds big.
Totally.
That's as we talked about in the past few years, those are some agencies shifting to a federal model.
What's it stand for?
Yep, Certified Community-Based Integrated Health Center. Very similar to an FQHC.
Okay.
It's a federal program. You will hear the acronym called something different at the federal level, but this is a federal program. And that's why we typically refer to it CCBHC, so folks can see how it matches up versus by its.
That's correct.
Okay, thank you.
Yeah, and so the federal government offers an enhanced FMAP for this, using this program and this service. So we get to claim it at 70.65% instead of the traditional 58.07%.
And and correct me, Commissioner Hawes, this program is an exciting program for Vermont because it allows us to do more comprehensive services in one place. It sets a set of standards for our mostly designated agencies at this point, And like a federally qualified health center ensures that an individual who is getting mental health, and they can get both mental health and substance use treatment, but they also can get physical health services and other services. So it's a comprehensive care model that's being administered by our designated agencies.
And the last two bullets just reflect the match that changes with the changes in the global commitment appropriations in the departments. It's the mixing bowl. Here's a slide that depicts our grants out that come out of the Secretary's office for both the refugee resettlement program. We have some miscellaneous grants related to direct service the field service grants that are related to direct service dollars, and a few other miscellaneous grants. And then to the Developmental Disability Council, they issue some awards as well.
So if we wanted to know why the miscellaneous grants went down to 7,000, is there something on Vantage we can look at, or can you just tell us what happened, or?
That actually is back on
slide. That was pretty.
Yep. So when we talked about reductions,
Yeah, these last two bullets
The
here,
last
the
two.
field service coordination grants.
Okay.
and Foster grandparent.
Foster grandparent, okay, thank you.
And on the foster grandparent program, you said that they weren't applying for it, but is that because the federal government froze the money? Is that, I mean, they froze a lot of programs like that. Is this one of them?
I don't believe so, because there's one other program still operating in Rutland. So that one is still in existence. My understanding is United Way stepped away from this program.
Okay, thank you.
Great, thank you. Yeah, Dave.
The Developmental Disabilities Council, is that general fund?
Federal.
So just curious, why would we give back money to the federal government for these kind of services? What's the backstory?
No, we're not proposing that. So actually, we're
Did I
making,
misread it?
yeah, these are just grants out. So
Oh, I'm
we-
sorry.
yeah,
I thought it
grant-
said cuts. I
No,
read
no,
it.
no, grants
so
out.
what you can see is in the first column, it's as the budget's passed. what
And
we're
you're just
recommending in
saying
the governor's budget.
Grants out. I misread. I thought it said cuts. Sorry.
Yep.
Thank
Not
you.
not an increase or decrease.
So, and then there are a few supplemental documents to address some of the other things requested for the budget presentation. So we have our typical ups and downs workbook that encompasses the entire agency's budget, the summary budget that the secretary identified, which is kind of an easier guide or summary. There's the list of state fiscal year 25 carry forwards and reversions for the entire agency. A list of the state fiscal year 24 audit findings and their status, and also the 1% community-based provider rate calculation.
So I'm looking online at the supplemental documents. Thank you for organizing it this way. This is very helpful in having a separate document. I'm just wondering if there's anything you want to let us know about the single audit findings.
I will say, actually, we've had a reduction in findings so that we are anticipating. So in 2024, we had 14 findings, but in 25, we've seen, and these are all in draft, so with the report is not final, we've reduced it to 5. And so we have made significant progress. I think one area to highlight is in the FFATA reporting audit finding. And I know this has been a statewide challenge, is where you have to enter in your subawards into the federal portal to identify any grants or contracts that you fund with federal dollars. You have to do it in a certain amount of time after execution, and some
Paperwork. Okay.
And so our internal audit group has been monitoring all of the AHS departments along the way, and we've made significant progress. And now we only had one agreement that was found in the sample that did not get entered timely. So that was significant improvement. And I know at the state level, they're very pleased with that because it reduces, the audit costs going forward, to not have to repeat that.
Great.
Yeah.
Any other questions from the committee? Yes, Dave.
Just back to the Human Services Board. Do you as secretary have the authority to reverse a decision made by the Human Services Board?
We rarely do that.
But you do have the authority. So if you feel it's just arbitrary or totally inaccurate, you can assert yourself.
This is one where I would want our attorneys in the conversation.
Sure,
But we take a very specific evaluation of those. The decisions that we look at for the Human Services Board really are whether they're compliant with our Medicaid. We rarely reverse them. This year, I think is one of the first times in history. And it had to do with its compliant with our Medicaid program. Katie Beckett specifically, in the one reversal this year. And so it's.
I just wanted to make sure you had the authority. I didn't know if it had been taken away years ago. Thank you.
Great.
I'd like to applaud your efficiency and effectiveness look through. And just as a question, given what you saw, how much more do you think, how much farther can you go? Is this going to be an ongoing thing or do you just have targeted places to look?
I think what we would say is, and I want to thank the teams, is that this year, the process that we went through to look for efficiency and effectiveness was a step forward for us as an agency. It's something that you all have asked us to do before in terms of evaluating our programs. It's something we took very seriously this year. So yes, I believe it will continue. I also want to take the moment to thank the teams who did this work. The commissioners were flexible and did work in a way that they'd never done it before. But it also permeates down to our policy team and our budget team and our program teams on the ground. It's a privilege to work with such an amazing group of dedicated staff who are willing to try something different in order to get a better outcome on behalf of Vermont.
I have to say that I'm very impressed with what you all have done. You had the hardest budget by far of all the agencies. And, you've been saying progress, not perfection, but I say you've made a huge amount of progress over what we've seen, in the past. And you're certainly meeting, maybe exceeding my hopes of where I thought we would be. And I think it ends up being a richer conversation. Great to hear from you guys. I know that our conversations with your team are now going to be that much better because we have. And I hope it was useful for you guys, though, to do this as well.
Yeah, incredible.
Yeah, I would.
Yeah.
Good.
Yeah, I think it's hard to describe how it fundamentally has changed the way that the agency is working together. And I think it comes from the teams. I also ask for your patience here because we are doing this as teams. It may be that we ask for more than one department to come in at the same time, like we see with our commissioners. Really are trying to exemplify that. But I would, again, thank our leadership team. And I think you're getting from the head nods, it really has made a fundamental difference.
Yeah, but it's a big difference. It's great.
Yeah, I echo that. I think, can you give us, and just one example of the way in which this process has facilitated closer collaboration and maybe programmatic change and maybe administrative change across departments?
Yeah, I'm going to speak to the way it was before, but I'd like our commissioners to speak to that. I apologize. I'm going to have a hard stop in about 5 minutes. The team can stay with you, but I'm going to have to go. In the past, when we've done what I've seen is what I've been asked to arbitrate between and being in the deputy's position before that, and actually in the deputy commissioner's position for that, what I saw is departments would say, that's not my client. And that should be paid for by this other department. And so we're going to eliminate that program and knowing that it was just going to impact another department. So An elimination of a mental health program has a significant impact on the children and families that we serve in DCF. And I would see what I would describe as this between departments, trying to get savings by just shifting it to by shifting the problem to another department, like squeezing a balloon. I didn't see that this year. And what I actually saw is on the ground departments working together to work together to own a problem or to solve a challenge for a population of the people that we serve. And I guess I would ask the commissioners to give some examples of some of those areas, but we've stopped the shift things from one vehicle or have just a single person decisions. That's not the way to lead an agency. We shouldn't have one charismatic leader. We should have a team of experts who can look broadly across the program and work from a consensus. Not that I don't make decisions, but I need an entire team to advise those decisions. So.
I mean, this is Emily from DMH. We're back in here a lot and we can highlight some of those, conversations and collaborations. But one that stands out for me is a rate increase specific to NFI, which lives in the DEVA budget, but is overseen by the Department of Mental Health. And that has historically been really challenging to match the rate that particular specific hospital diversion program does and how it impacts every commissioner that's sitting right here. And so, we met almost on a weekly basis over the summer and being able to have those conversations about what that particular program does in the full scope of all the things that Medicaid is funding that each commissioner is trying to make decisions on. And for me, that was a really good example of everyone looking at one thing and they're serving directly. I've gotten to be a part of many of these budget seasons, and this one was the most helpful for me. I learned more about everybody else's budget, good or bad, this sort. So
That's great.
there was conflict, and that was okay. It's okay to have conflict.
Yes, it is.
It's okay to have good, hard conversations, and then it's
Yeah.
it's an excellent product.
Great.
I think it just changed our identity from being a commissioner of a particular department, being a commissioner of a particular department and member of the executive leadership team. That has reduced not just the budget process, but actually all of our work going forward. Excellent. That's great.
It's great. Dave?
Last year, we appropriated $10 million for the stabilization fund. This year, thought I saw in Adam's presentation a $2 million ask. Could someone, you may have already provided this, but if somebody could just give us a little spreadsheet that says, here's how much we've given out, here's how much is left. And maybe thinking about some language just in case provider A is in a real difficult situation and the 2 million's gone, to give someone the authority to do something. So it doesn't go under when we're out of session or something like that. Thank you.
Diva, who is administering the program this year, can definitely give you that.
Yes.
And that is actually another one of I was going to highlight, is one of the places where we've seen a lot of collaborations with the provider across.
Great.
I apologize.
No,
There, I have to go.
I think we're about done. And I also want to thank you and thank your whole team. This is really great. I really appreciate all the work and I'm glad it's also been useful to you as well. I think it's going to be better for
Good job.
all of us. So,
Thank you.
thank you very much. All of you, we'll see you again when it's your turn.
Thank you for having us.
Okay, thank you.
Casey, if you could tell the other business managers